You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you've enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you. Hello, this is Richard Jacobs with the Future Tech and Future Tech Health podcast. I have a returning guest, Dr. Kutsch. He's a really cool guy. He is the owner of a company called CariFree, C-A-R-I free, Cari as in a cavity. They make a series of toothpastes and mouthwashes and all that seem to be, in my estimation at least, far superior to what's out there. And we'll go into why and how his products work and everything. And he's a dentist. I learned a lot from talking to him last time, so I wanted him to come back. So, Kim, thanks for coming.
Hey, I'm glad to be here.
Yeah, for people that didn't get the first podcast, what spurred your interest in dentistry however many years ago?
You know, I've been reading this book called The Last Arrow, and it talks about how so many of us in life don't ever really find our passion, right? And I'm reading this whole book, and I'm thinking like, man, at age 6, I knew I wanted to be a dentist. Sitting in the dental chair, I was so fascinated by all of the equipment and the dentist and everything. And I had a lot of cavities as a kid, because that was a long time ago. But I mean, I've always just wanted to be a dentist. I love helping people. And I think, I think the things you need to be successful in life, you need to figure out what it is that you love, that you're passionate about. And you also have to figure out the things that you don't like. And, so the things to understand me as a person, I love helping people. And so I'm able to do that through my dentistry. And the thing that I dislike the most is when I'm trying to help somebody and it doesn't go right. There's a problem. It doesn't go well. And I think for me, that kind of consolidated with this whole model of cavities. We were taught to drill and fill when I was in dental school. And to a degree, dentists are still being educated that way. But 20 years into practice, I was frustrated by the fact that now all these patients of mine are friends and family, and I'm doing what I was taught in dental school, and they'd spent a lot of money on some expensive dentistry, and then 5 years later, we'd see it fail because they got new decay around it. And so for me, that's the thing I don't like. That was the frustration. And I thought, what I was trying to do doesn't really work all that well, because if it did, this expensive dentistry shouldn't fail like that, because the patients were doing what I was asking them to do. They were, brushing their teeth, they were, watching their diet and what have you, and yet they were still getting cavities. And I thought, what? I really don't understand this disease. I mean, I know how to drill and fill like as good as anybody in the world. I mean, American dentists are so well trained at restorative techniques, and our materials, we're literally I would say we're the best in the world at that. But by and large, the education we get on this disease itself that we're repairing the effects from, we don't really have a big grasp on the disease itself and what causes those cavities.
So what I've been reading a lot about the oral microbiome, so I figured that plays a major role. But, in your estimation and your knowledge now, like what causes cavities, or maybe that's not the right way to look at it. What causes the mouth to experience gingivitis or cavities or plaque or all the things that happen to it?
Yeah. So Richard, I mean, the thing is, it all goes back to pH in the mouth. And so one of the things that we started identifying, we started looking at, dental caries. That's the name of the disease that causes cavities. We started looking at that as a whole person disease, not just a bunch of holes in somebody's teeth, but rather than a disease that was causing those holes. And we were looking at the end effect of that disease. So what we backed up to look at, I really wanted to understand what's causing that disease in the first place. And so I started just digging through our scientific literature, and this is 20 years ago. And at that time, was fortunate enough to be introduced to Dr. John Featherstone at UCSF, Dr. Doug Young at University Pacific, and Dr. John Coyce in Seattle. And those people really mentored me on my journey through trying to understand this disease and what it boils down to. And Dr. Philip Marsh from Leeds University in the UK, what it really boils down to is pH. And that microbiome that you're talking about, those bacteria help in a healthy mouth, help maintain a healthy balance. Every time you eat, your mouth becomes acidic. And it doesn't matter what you eat. I mean, the digestive process starts kind of in the mouth. And so the microbes that we have in the mouth start to help us digest our food. We literally wouldn't survive without them. But in the process of the pH dropping and becoming more acidic, you start to lose mineral out of the teeth itself. And the other thing that happens is you have longer periods of acidic episodes, and there's reasons that cause that, and I'll share that with you. But then it changes the microbiome. So instead of having the healthy group of microbes, what you've got is predominantly microbes that thrive in an acidic environment, and then they perpetuate that acidic environment. And pretty soon your tooth dissolves to the point where you've got a hole in it. Now you got a cavity. Some of those microbes invade the teeth. So that's really the cause of what starts that whole process. So it's really a function of the pH in the mouth. And then you've got microbes in a healthy mouth. You have microbes in the biofilm, the microbiome itself, that actually help raise the pH. And then your body starts releasing all this saliva, and the saliva that comes out when you start eating, the stimulated saliva, is very alkaline. And so it's trying to protect your teeth immediately as well. So you've got this whole process that happens, and as long as it stays in balance, we're healthy and nobody gets any tooth decay. The problem is when it's out of balance and either you don't have enough saliva, which I think is probably the number one cause of cavities in the United States today, and we'll talk about that. Number two, you're just eating too frequently, or the person's eating too much sugar, which causes a rapid decrease in the pH, or let's say a rapid increase in acidity in the mouth. And then, being able to control that plaque level every day by brushing and flossing and cleaning your teeth, plaque removal, reduce the amount of kind of the oral microbiome kind of hitting the reset button every day on that. Those are the major drivers for the balance of this pH in the mouth. And then, the last one is genetics. And that's kind of been a wild card for us, for the last 9 years. And we're starting to kind of get a grip and kind of understand that a little better. But that's really, at the end of the day, you have all these risk factors and things that play a role in the balance of the mouth. But at the end of the day, it's all about the pH, because the pH causes... Yep.
Quick question here. I might have a story on the genetic side.
Yeah.
I recently went to the dentist. Mine's not like, they're okay. But I guess I'm one of those people that never gets cavities. And so I didn't go to the dentist for a while. And
right.
The assistant told me, she said that she noticed that people that don't get cavities tend to accumulate a lot of plaque. But people that get cavities may not accumulate much plaque, but they get lots of cavities. So she said there seems to be a trade-off, and she didn't know why. Is that in your experience?
Richard, one thing I would say that we all see pretty commonly that we really haven't understood completely either is that people that get a lot of cavities don't tend to have gum disease, and the people that really suffer from gum disease don't tend to get a lot of cavities. It's not totally rare, but it's kind of unusual when I see somebody that has severe gum disease and periodontal disease, and then also severe tooth decay at the same time. So you tend to fall kind of into one camp or the other, and some of that may be explained by genetics or certainly by your environment. But I would tell you that some people develop a real thick plaque, heavy amount of plaque on their teeth, and they don't necessarily tend to have a lot of cavities. We see that a lot, particularly in teenagers, particularly if they're going through orthodontic treatment. We'll see these kids come in that just have this thick plaque on their teeth, and yet we clean it off and they don't have any decay underneath it. And then we see if you've got the wrong microbes, it doesn't have to be a lot of plaque. It's just if you have the wrong microbes, those acid-producing, acid-loving microbes, you can have a fairly thin plaque on your teeth, and boy, it destroys the teeth in a hurry. So it's really not necessarily about the plaque level as it is which bacteria are present, but even more importantly, what are the bacteria and the microbes that are present doing? Are they producing acid and creating an acidic environment? So that's really So you're lucky. I mean, you're fortunate you've got a healthy oral microbiome in your mouth. And as long as you don't do anything too extreme, you're going to stay healthy.
Yeah, my wife's jealous because she's the opposite. I've had like no cavities my whole life, and she's like brushes her teeth till they fall off, and so. But,
I had the same, Richard. I had the same experience as a kid. My sister had very few cavities, and I mean, every time we go to the dentist, I'd have like 6 cavities, and my sister would have like none or maybe one, and that was very frustrating as a child because it seemed like this is not fair. We're in the same home. We have the same parents. We're eating the same food. I probably brushed my teeth and took better care of them than she did. She never got any decay, and yet it seemed like every time I went, I had a lot of cavities. And I look back now, I understand exactly what was going on, and it was genetic.
So let's go back to the pH. So what is the pH of a mouth with no food in it? And what does it go to when you eat? And then how fast does it return to normal?
In general terms, I mean, this is going to vary for everybody, but in general terms, your resting saliva has a pH of about 6.5. So neutral is 7. Anything less than 7 is acidic, and it's a logarithmic scale. And anything greater than 7 is then alkaline, or less acidic. So when you have a mouth at rest, typically you have a pH just slightly below neutral. It's about 6.75. Now, interestingly, the enamel doesn't start to break down until it gets to a pH of 5.5. That's kind of, these numbers vary a little bit, but that's a pretty good rule of thumb. Now, if you've got enamel that's been exposed to a lot of fluoride, that doesn't start breaking down until about a pH of 4.5. So the advantage of fluoride is it helps strengthen the enamel and makes it more resistant to that acid breakdown. On the other side of the coin, so as you start to eat, the pH in your mouth could drop down as low as 3, 3.5. A lot of the foods that we eat influence that as well. Like a lot of the coffee has a pH of 3.5. So you put that in your mouth, immediately it's going to, drop the pH in your mouth. And on the flip side of that, stimulated saliva has a pH somewhere between 8 and 9. So immediately your body is trying to overcompensate, for that. It's producing the saliva that's very alkaline to try and help drive the pH back up. Now, in a healthy mouth, it takes about 30 minutes or so for that to kind of go back to neutral after you eat. So it takes a little bit of time. And then the challenge becomes like for people that don't have enough saliva. And that is typically caused by medications. And we know that like 70% of all Americans across every age demographic take at least one prescription medication a day. 55% take 2 or more, and 25% take 5 or more. And the most common side effect of all of our prescription medications, the number one side effect, is dry mouth. So if you reduce the amount of saliva, suddenly your body can't protect the teeth every time you eat. So your eating episodes become more and more critical for you. So if you have 3, regular balanced meals a day of whole foods and you're doing all the right things, that's great. If you just snack twice during the day, that mouth may take an hour or even 2 hours to recover back to, because you don't have as much saliva. And if you snack, it drops the pH immediately again. And pretty soon you're spending more time in that acidic zone, which is demineralizing or, breaking the teeth down from the surface, than you are spending in a healthy time where, you've got the mineral going back into the teeth and keeping them whole. So it's kind of this delicate balance that goes on in the mouth. The other thing about the saliva that's really important is that your saliva is super saturated with the little building blocks of enamel. They're nanoparticle size, but that hydroxyapatite mineral, 20 nanometer particle size, it's like if you could think of a tooth that is built out of little Lego blocks, those are the little miniature Lego blocks that the enamel forms from. And so as you eat and it gets acidic, those little Lego blocks come off the surface of the enamel, and then when the saliva and some of the microbes in the mouth start to drive the pH back up, those little Lego blocks go right back in the enamel, reform. So that's kind of going on all day long. Every time you eat or you drink something, in the mouth, those are the kind of things that happen. So you got to have.
Where is the source of the saliva? Where's the source of the hydroxyapatite, the building block of the enamel? Is it inside the tooth coming out, or is it in saliva?
Okay, so the teeth are built out of that, but then the source for it the saliva itself is super saturated with those little particles of mineral. So your body is maintaining these teeth by keeping them bathed like 24 hours a day in a super saturated solution of the exact mineral that they're made out of, so they stay mineralized and stay healthy. So the saliva is probably the biggest protective factor we've got in the body. It's nature's way to protect your teeth. And as soon as you start cutting, the amount of saliva that you have available, that throws things out of whack in a hurry.
What if you did a tongue twister of Sally sells super salivated saliva by the seashore?
Yeah, that would be a tough one. But it's
Okay.
so it's really, you look at all these different risk factors, and it becomes kind of a delicate balance. But the one thing I started doing about 20 years ago then was I took health questionnaires, which we call risk assessment forms, and we had the patients start to self-identify. Here's my risk factors, and we have a series of about 8 questions. And it's pretty simple. And what I found for most people that were having a lot of tooth decay, they weren't doing a million things wrong. They were just doing maybe 1 or 2 things wrong that was putting them at greater risk, that was driving this disease for them. And just being able to identify that, help them understand it, gives them the opportunity to then correct it for themselves. And once you get it corrected, you get back in balance, you stop having decays. It's not rocket science. And it all comes down, I'm going to probably say this over and over today, but it's all about the pH. At the end of the day, this is a disease of pH. So it's being aware of what causes your acidic episodes and what your risk is, and, with those episodes, and then how to get back to health.
So what if you did a protocol of after each meal, you, gargled or rinsed with some high pH water and then drank some, to passivate your mouth between each meal?
That's a great idea. I mean, particularly if you're short on saliva, for somebody after they eat, to rinse with an alkaline water, even neutral water. I mean, tap water. Typically, tap water is has a pH of about 7.5. In most communities, it has some fluoride in it. That's much better than. You have to be real careful. About half of the bottled waters on the market have a pH of right around 4, so they're quite acidic. So,
you told me that. Why is that? You told me last time, but just for listeners.
It's about, I believe it's about shelf life stability, because they take the chlorine and everything else out of this water, and then to keep it shelf life stable without having things grow in it, they acidify it. And, so it's all about shelf life. And a lot of those are made by the soda manufacturers. And, most of your sodas have a pH of somewhere around 3.5 to 4. So it's pretty consistent. But so you just have to be careful, what you're rinsing. I always tell patients rinse with water, but I always qualify the best, fastest, easiest, most convenient, cheapest thing to do is rinse with tap water. If you want to rinse with alkaline water, I mean, even better yet. So, because that's what your saliva, you're basically trying to replace the activity that your saliva is responsible for. And so, rinse with water. One of the mistakes that people make, and it's kind of crazy because it seems backwards, but we were always taught, you eat and then you brush your teeth. And a lot of our toothpastes that are on the market today are, number one, they're acidic and they're very abrasive. Particularly the whitening toothpaste have a real high abrasive level. So if you eat and then that these little building blocks have kind of out of the surface of the enamel, and then you brush right away before they have an opportunity to recover and go back into the enamel, if you brush those away, you literally, like right away, I've seen patients that have all but, brushed all of the enamel off their teeth. So you're better off to brush your teeth first and then eat. If you're going to brush like 2 or 3 times a day, brush before you eat. Or brush, at least wait 30 minutes for the enamel to recover before you brush your teeth. So you're not brushing away all those nanoparticles of mineral.
Oh, well, so the act of brushing is actually, so it's not good for your mouth if it's after meals, and it's not good for your mouth if it's done too strenuously or too often. So how can you make, is that why you created your toothpaste and your mouthwash, to make brushing a positive event?
Yeah. So what we did, we reduced actually the abrasivity level of our toothpaste is very low, because you don't really need that much abrasive. You basically, all that's doing is just keeping the stains, like coffee, cigarette, tea, those kind of stains off your teeth. So you just need enough to keep your teeth from staining, but you really don't want to take more of the biofilm. If it's healthy, you don't want to take it off the teeth. And the pH then, is really important. And so we created an alkaline system so that the pH of our products runs from about 8 to 10.5. The gel has a pH of 9.0. So we're trying to like help be protective in that pH environment to help retrain the biofilm to become more balanced or more healthy, as you would say. So it's really that our whole system is built around pH.
What if we did a thought experiment? If I compared, not brushing my teeth for a month, but after each meal, like rinsing and gargling with alkaline water versus like brushing my teeth twice a day with normal toothpaste and normal water and everything, and brushing them hard, I guess like most people do, but not using alkaline water.
That would be an interesting experiment. Would prefer you to see you brush with just brush with an alkaline water. Just kind of reduce the overall plaque level, but keeping everything kind of alkaline, helping train the biofilm to behave in a healthy manner, and maybe even select for a better assortment of microbes in the microbiome there that are going to help keep the mouth protected. Better than using a high abrasive, acidic, any kind of oral healthcare product. So that's one of the challenges that we have.
Well, I use, for listeners, I use your toothpaste and stuff. I don't use the mouthwash, but I use the toothpaste.
Yeah.
And I noticed that when I use it, at the end, my teeth actually feel cleaner. They don't feel like they have any film on them.
Right.
I've been using it for a few months now, and it seems to, I seem to be accumulating like less plaque, and it seems to be working, and my teeth are just better off. So that's just what I do.
It's, I always tell people, particularly because I teach a lot of dentists. I teach in some dental schools, and I teach, dental hygiene programs and what have you. And I always hand them the gel, and I say, this is for your patients, but I want you to start by using it yourself, because the first thing you'll notice takes about 4 or 5 days, but you'll wake up like the 5th morning or so, and your teeth will be clean when you wake up. There's a healthy microbiome, a healthy biofilm on the teeth is very thin. And so they're going to feel very clean. And the other thing is it doesn't build up rapidly, that healthy biofilm, so they stay clean throughout the day. I don't know if you've noticed this or not, Richard, but the one thing that, that I appreciate, the one thing that I first noticed about these products was that for me personally, I woke up in the morning, my teeth are clean, and then they stay clean throughout the day. It was like, it was the first time in my life I'd ever experienced something like that. And I hear that pretty consistently from people that use the products. Are like, yeah, gosh, my teeth, they feel so much cleaner after I brush with the gel. It works so much better, and then my teeth stay clean, and they're easier to keep clean. And then I go in for my checkup, and it seems like I have less plaque buildup or have less stain on my teeth. And I've noticed that on my own mouth as well. So it's been kind of an interesting journey, but we're excited about that because it helps people. And again, what you need to know about me is my passion in life is being able to help people.
Well, you mentioned last time a study, I think, done in Australia with children's teeth. Can you restate what you said last time?
Yeah, so we did a study on children in Townsville. It's in Queensland, Australia. It's very rural and a kind of a poorer section of Australia. And so these 2 grade schools that we included in the study, both of these schools were very high risk for tooth decay. So all these kids, and so these were kids in grade school, from 1st to 6th grade. We would call them mixed dentition. They still had some baby teeth. They had new permanent teeth coming in. And these kids were developing on average 2 new cavities per kid per school year, which is a lot of decay. And so we tested our one rinse that has a pH of 8.0, which we recommend just for people in general to use, against our treatment rinse, which has a pH of 10.5. And it's really designed as an antimicrobial type rinse, as well as, cavity protection. And in the one group, and so they had a supervised rinse at school for 30 seconds. They were in school 4 days a week, and this was like 9 months out of the year. So it's a fairly limited protocol. That's all we did in the study. We didn't teach them anything else. We didn't teach them how to brush. We didn't talk about diet. All we did was we gave them a supervised rinse, once a day at school. And the kids with our over-the-counter rinse reduced their decay rate by about 30%. And the kids in the treatment rinse group reduced their decay rate by 73%, just by using that rinse. And that was over a period of 2 years. And I can't quote anything else in the scientific literature, any study with anything that got those kind of results. So, that's really significant to be able to reduce your decay rate by 73% just by using a rinse. It's pretty remarkable. Yeah, we're pretty happy.
Have you noticed that that having your rinse changes your perception of taste? Like, have you ever tried it right before a meal, or just alkaline water and see how that affects the taste of the meal?
It's interesting because our products don't have a really strong minted flavor or any of the flavoring that we use. We use some grape and we use some citrus, and but they're not they don't have a real strong flavor with it. We don't put a lot of that in the product, and so it doesn't tend to affect your taste perception. So you could, for instance, brush your teeth and go buy your Starbucks, your $7 cup of coffee, and not have the taste influenced by that, whatever you use to just brush your teeth with. In fact, I have a dentist researcher who buys product pretty regularly, and he tells me, and what I love about your product the most is on Saturday morning when I go for my Starbucks, he goes, it's my big treat, of the week. I go get my Starbucks, and it doesn't, your product, I can brush my teeth, and it doesn't change the taste of my Starbucks. And
that's good.
Yeah, so it is good. It's something we hadn't ever really even thought about, but yeah, I would agree with him. It doesn't change your taste.
Yeah, well, since pH is such a big deal, I'm sure, again, it modulates many things in the mouth, perception of taste, and just all kinds of things.
Yeah.
You mentioned that, okay, so cavities happen, the science is that the bacteria that are acid-loving, I guess, predominate in the mouth, and then they start eating the hydroxyapatite that constitutes the tooth?
Yep. And
what do they make it into? What do they metabolize it into?
Oh, it just actually, so what happens, it just comes, they don't metabolize it itself. It just, because of the pH, it just starts to break down and comes out of the tooth. We use terms like dissolve, but then you swallow it, basically it's gone. So we use terms like it dissolves, out of the teeth, but minerals don't really behave that way in nature. So you actually have these little nanoparticle blocks of this mineral that come out in a piece of these little nanoparticles of pieces come out. So it's not like you would think of an ice cube melting. It's more like as little tiny chunks of the ice cube, came out. And so it kind of disassembles, I think is a better, maybe a better term for this, is like, the enamel kind of disassembles. Now, once the enamels disassemble to the point that there's a hole there, the bacteria and the other microbes can invade the tooth. Now, so you've got the shell of the tooth is enamel, but the interior of the tooth is called dentin, and it's about 60% protein. A lot of these bacteria and these microbes can actually directly digest the protein that's inside of the dentin. And so once the decay gets inside of the tooth, a lot of times it happens fairly rapidly, because now they've got something that they've got a food source for themselves, and they start to actually digest it and break down the protein that's on the inside of the tooth.
Interesting. Okay. So in an ideal situation, if you have, I don't know, I'm just making this up, 1 millimeter of enamel, that'll get, burned back or dissolved back to a 0.5 millimeter, then restored, then back and restored, back and restored. So you never go through all the virgin enamel and get to the dentin.
Yep.
But I guess someone with a bad diet, they're ever so slowly
it just keeps going,
losing ground, right?
Yeah, it just steadily keeps losing ground, right? Yeah, so you're right. It happens really on a nanometer scale, not really like a 0.5 millimeter. You have about 1 millimeter to 2 millimeters of enamel on the surface of the tooth, depending upon which surface of the tooth. But you're only losing just right at the surface. But if you just keep losing it in an area, eventually you'll get all the way through the enamel and that whole millimeter all the way through, and then you've got a hole that's down into the dentin. And once you got a hole in the surface of the tooth, we really need to go back in and put a filling in the tooth. We need to restore that. But until you have the hole on the surface, like, you can have some mineral loss out of that enamel, and it can start to be kind of porous and poorly constructed as it disassembles. But unless you have an actual hole in the surface, you don't need to put a filling in it. So we have an opportunity to reassemble that enamel, kind of remineralize it, and help that site repair itself. So that's part of our goal, is to be able to do this non-surgically and, identify it early enough, help the patient so that they can stay healthy and they don't end up with actual cavities.
Well, it seems like if you had a mouthwash whose job was solely to passivate the mouth and restore enamel, you gargled with it and swished for, a minute or 2 minutes every day.
Yeah.
How much could that help you to close holes or to restore the enamel in your teeth?
Well, we know it works, right? So I don't know that we have an exact, we haven't done research to the point of if you use this quantity for this amount of time, over this period of time, it's going to repair, this depth of a lesion in the enamel. But I can tell you that it does work. I mean, we see it clinically. We know that in scientific studies, you can remineralize a lesion, a white spot lesion that's 200 microns, which is 0.2 of a millimeter. We can completely make that disappear. Lesions that are deeper than that, we can at least remineralize the surface of the enamel and make it stronger so that the lesion doesn't continue to progress down underneath the surface. So either way, you're going to protect that surface of the enamel and make it stronger and make it more resistant to having a cavity.
What about mouth breathers versus nose breathers? Have you seen any difference, or as people age, does their saliva go down significantly and this accelerates? Like those two scenarios, what have you seen?
Yeah. So number one, I mean, as we age, all of our organ systems don't work as well as they did when we were younger, and so that's a natural part of the aging process, is that you have less saliva. I think one of the challenges we've got today in America is not only are people aging and they have less saliva, but as we age, we tend to take more medications for our diabetes and heart disease and blood pressure and what have you. It kind of compounds that problem because of the fact that now you've got less saliva naturally, and now we've driven that even worse because you've got even less saliva because of the medication and the dry, the side effect from your medication and the dry mouth. So that's just a huge challenge for us. And again, 70% of all Americans, and now we're talking down to age 6 months. You look at allergies in children today, asthma, and they're using antihistamines, which again cause dry mouth. It's one of the side effects, and GERD is an issue for kids. So, it's a challenge for all of us, but particularly it's a challenge, I think, as the older we get, the more likely we're going to have other systemic disease issues that we're probably going to be taking more prescription medications for. Mouth breathing, on the other hand, is a whole other topic. And I think airway issues in dentistry, that's really an evolving science in the last, I would say, about 5 years. And of course, I've gotten involved with a lot of the thought leaders in airway, and dental issues because of the tooth decay aspect of that. But certainly, if your mouth is open during the night, your mouth is going to dry out there as well. And again, you don't have as much saliva available to protect the teeth. I haven't seen those people per se. We haven't seen that as an isolated risk for tooth decay, but certainly it's something that's not helping you.
Okay.
Yep.
And for listeners, with your eyes, let's go over 4, 5, 6 common things that people do to their teeth, in an attempt to improve them. And what, with your knowledge, what does it do? Like tooth whitening, braces, tell me some of the common things you see people do that unintentionally hurts their teeth.
It's more lifestyle probably than anything else. Like, certainly the tooth whitening is safe. You don't want to over whiten your teeth. If you're using some kind of a peroxide gel or a white strip or one of those types of professional whitening products that are specifically designed just for tooth whitening, that's a very safe procedure. We've been using bleach in dentistry dating back to the 1860s, so it's not like that's going to create a lot of issues for you. And one of the side effects of that bleaching product is most of them are quite alkaline. So that's kind of always helps drive that biofilm in the right direction, right? The challenge for us is that a lot of like toothpaste are described as whitening. They're whitening toothpaste, and a lot of them have really high abrasivity levels. And so I always tell patients, you got to be really careful. Maybe it's okay to use a product that has that high of an abrasivity, like once a week or, once a month, but it's not something that you would wouldn't be good for you to use like 3 times a day. I see so much damage to enamel, and people, I think they're just I think that in that industry that we have a tendency to use more and more abrasive, and it makes your teeth whiter and gets the stains off, but at the same point, what costs to the enamel. And so I see patients that develop the little notches along their roots, and I can't help but think that a lot of that notching is caused by a really abrasive toothpaste, and they're kind of just scrubbing their teeth like linearly back and forth, which we all have kind of it's easier to brush your teeth back and forth than it is kind of in a circular motion, which we should be doing. So I think that's probably one of the biggest challenges that I see. And you end up with these deep notches in your roots. And if you're getting those as a patient, you don't want to get too deep otherwise, because you got the nerve is below the surface there at some point, and you really don't want to damage your tooth that way. And so we end up placing a lot of restorations. When I'm in practice, I sound like a broken record, telling people to stay away from these really abrasive toothpaste. And if you want to use them, just be careful in how often you use them. But so that's a challenge. I think other lifestyle stuff is certainly sugar in the American diet is huge, and that's driving that acidic episode, making it worse because sugar is so rapidly digested by your oral microbiome, and it produces acid immediately, that you have to be really careful. And on average, Americans we're consuming 23 teaspoons of sugar per day, and if we look at the World Health Organization recommends that for us to have a healthy diet, that we should have no more than 10% of our caloric intake should come from sugar. So now we're down to like a teaspoon or so a day. And they say, and if we were really being honest, we really shouldn't have, our best goal would be no more than 5% of our caloric intake coming from sugar. Well, now you're down to like a half a teaspoon. And then they go further to say, and if we were really, really, really being honest, it should be no more than like 3%, which is like, a third of a teaspoon. And if you go, and I always tell patients, I carry these in my briefcase, to pass around when I'm teaching classes, but to look at in a baggie 23 teaspoons of sugar, and then look in another baggie that has like, less than a half a teaspoon of sugar. Here's what we are eating, and here's what we ideally should be eating. I mean, it's shocking. And then you start reading labels, and it's hard in our Western diet within our society. It's hard to avoid sugar. I mean, it's addictive. They put it in everything. And a lot of it's hidden. Like if you could see how much sugar was in a can of Coke, a can of soda, let's not pick on Coke because they're, soda. If you could look at, how much sugar is in that can of soda, or that 16th ounce soda, or that 32 ounce big gulp, if you could see exactly how much sugar was in it, you might think twice about drinking it, because those are just empty calories, which aren't helping your teeth. But as soon as they get past your teeth, it's a direct driver for obesity, hypertension, coronary artery disease, and cancer. So, we've got these other systemic conditions, that follow right behind the mouth as well. So that's, I think those are two of the biggest lifestyle things I think I see.
This might be my perception, but now that I don't use the normal toothpaste, like they taste like they have a lot of sugar in them. So it seems like toothpaste adds sugar too, which is ridiculous.
Yeah, and I don't know. I couldn't tell you off the top of my head if and how much sugar, or what kind of sweeteners. I think they tend to have maybe more artificial sweeteners, kind of on average, but they tend to be quite sweet, quite strongly flavored, and quite sweet. That would be my perception as well.
Is there any studies on the residence time of food in your mouth? I mean, you're chewing it, you swallow it, so it's probably 5 to 10 seconds, but the stuff that's left behind, is there any studies on the residence time of that food that's left on your teeth, and how much, and how fast it gets cleaned out by the body?
You asked some really, I really enjoy your podcast. I have to tell you this.
Thank you.
You asked some really interesting questions, things that I think within the profession we don't tend to ask ourselves, because that seems like that would be a really obvious question. Well, how long is the food on your teeth, and what effect does that have? And after you eat, if some of it's left on your teeth, what kind of effect does that have? I'm sitting here, racking my brain. I can't think of a single study that I have read that addressed that exact question. And yet it seems kind of obvious that it's something we should consider. It would be, I'm just thinking also about study design. It would be really hard to design a clinical study around that, trying to measure that. But certainly it makes sense that the longer you have the exposure of the food on your teeth, the longer the acidic episode is going to be. And the sooner you can get your mouth, you kind of flush that and get the food out of there, the sooner your mouth has an opportunity to recover. So,
okay.
Yeah,
I was just imagining flossing too. If I eat a rib, and a piece of rib gets stuck between my teeth, it just seems like, an area of continual ongoing acidity.
The sooner
and the local environment it creates is
absolutely
kind of anaerobic too,
Yeah. The sooner you get that, the sooner you use the floss and the toothpick and get that piece of meat out of there, the better. Although, the meat's not going to be digested as quickly as, say, you're eating a milk dud, some sticky piece of candy, and that's stuck in between your teeth, and it was there for say hours before it dissolved. That would have the opportunity to create a much worse effect than maybe a little piece of meat.
That's true. So how has your practice changed? You don't recommend regular toothpaste. You obviously, yours is better formulated. That makes sense. But what else has changed in your advice to people?
I think that the biggest thing, it's just that rather than sitting down and looking at a patient's mouth and trying to figure out how many cavities they have and how we're going to restore them, I sit down and look at them and, first question I want to know is, if you have cavities, why do you have cavities? So rather than, and we always jump from A to Z. And this is how we're trained, as dentists. You see a hole, I'm already thinking about how I'm going to fix it, right? And instead, we have to step back and ask ourselves, why is there a hole there, right? Because a healthy person wouldn't have that. We need to stop back, and instead of looking at that surface of the tooth, we need to step back and look at the whole person. This is a whole person disease. So what about this person is causing that hole in that tooth? Because if we can figure out what that is, that's how I can the best help that person, get healthy again. If all I do is fill the hole, which is what I was trained to do, and, tell them you need to brush and floss, if, you keep getting cavities, well, you're not doing that well enough, or you're eating too much sugar, or, you need more fluoride, or we would throw these things out there, but, while it's simple, you have to take a little deeper look at it than that. So, the question I ask now is, why? Why does your tooth look that way? Why are you getting decay? And because if we can figure that out, I can help you stop getting cavities. That's the greatest help that I can provide for you. So I would tell you, how's my practice changed? I've been doing that for the last 20 years. And it's such an emotional change. It's such an emotional experience for people to stop getting tooth decay, particularly the people that have a lot of serious tooth decay, or maybe at the risk of losing their teeth, that they have that much severe disease. And so that's such an emotional journey that you really develop a much deeper relationship with people, right? So it's not like I'm their dentist, it's more like I'm kind of their health coach, and we're kind of on a journey together. And so it's changed, I think, my level of satisfaction, and in my practice itself, I feel so much more emotionally rewarded because I like to help people, and because now I am truly helping people. In addition to just, creating a pretty smile for them, I'm also helping them create a healthy future for themselves. And so I think for me, that's a lot more rewarding. And like I say, it just deepens the relationship that I have with the patients. So it's been wonderful. And I would tell you this, I have more and more patients having fewer and fewer cavities, which is that was why I went into dentistry in the first place. So that's pretty exciting.
Yeah, no, that's great. If you look at things through the lens, I don't know if you believe this, that, your mouth can be in a constant low inflammation state, or, cavities and mouth disease is an inflammatory state. How often should people get their teeth cleaned? I know it depends on the person, but what's an ideal schedule?
There is no ideal schedule. And one thing that I think we're starting to look at, and this has been a major movement in medicine in the last 10 years, and I'm kind of trying to advance this concept in dentistry, but, looking at P4 medicine, and, P4 medicine it's predictive, it's preventive, it's personalized, and it's participatory. So if you kind of look at tooth decay, I want to be able to predict with, looking at your risk factors, are you at risk for decay or not? I want to be preventive so that I can look at, if say you've got the disease, say you've got some tooth decay, I want to know how we can help prevent any future decay. And then I'm going to personalize whatever recommendations we have based on your exact history and your personal makeup and your environmental lifestyle, etc. And then the participatory part is helping me coach you so that you know what to do, how to make those changes for yourself. So, taking a look at that, adding that kind of, then taking a look at that into dentistry, that's kind of how we approach, tooth decay now. What was your question, Richard? I think I got something.
Oh, well, yeah, I was going to ask, okay, so do you think of cavities and mouth disease as like a low level of inflammation, a persistent low level?
Yeah, and you were asking about the ideal schedule to get your teeth cleaned, right?
Right.
So for that person that's at very low risk, they don't have any tooth decay, and they don't have any gum disease, or they're not developing any bone loss around their teeth. Once a year would be the ideal schedule for them. Now, if you were moderate risk for tooth decay, which means that you've got some risk factors, but you really don't have any cavities, a better schedule would be twice a year. And then if, it's just so that we get an opportunity to see you a couple times a year, because cavities develop fast in somebody that's got a lot of risk for the disease. And literally in a 6-month span of time, I've seen people have enough decay that they came out of nowhere, they lost a tooth within 6 to 9 months. So we kind of like to see those people at least twice a year. And if you've got a kind of a severe history of tooth decay, the best schedule would be to see you every 3 months, so that we can monitor, we can help you, with coaching with your progress on whatever lifestyle changes you're trying to make. And I can't change your DNA. I can't take you off any medications that you're taking for other systemic illnesses. So I really need to be as proactive as I can be to make sure that we help you avoid any tooth decay. So for that patient, it's like every 3 months. So the answer to the question is somewhere between once a year and 4 times a year, but it really depends on the person. Now, you kind of overlay that with, well, then we also have gum disease to deal with. And if you are low risk for gum disease, which means you don't have any inflammation around your gum tissue and you're healthy, once a year is adequate. If you get a little bit of inflammation or a little bleeding of your gums here or there, maybe twice a year is recommended. And if you have, a more advanced or aggressive form of gum disease, we again should be seeing you like every 3 months to clean your teeth and clean your gums, the roots of your teeth. That's the best preventive measure in all of our scientific literature, is cleaning your teeth like 4 times a year. So I think you're starting to see, rather than brush with Pepsodent, see your dentist twice a year, I think you're starting to see in that P4 model of medicine being more personalized to like, okay, for you only need to come in like one, so here's the deal, Richard, you only probably need to go to the dentist once a year at most. Your wife probably should be seen 4 times a year. And yet we tend to do this one size fits all treatment where everybody comes in twice a year. Well, that's the other thing in my practice. I started to like personalize. I really need to see you every 3 months. But you know what? You're doing great, Richard. I don't need to see you for a year. But when you come in next year, I'm going to ask you are you taking any new medications? Have you changed your diet? I'm going to start looking at those risk factors, just a review of those, so that if there's some change there, I know about it. Because maybe next year, let's say you develop an allergy to the dog that's living in your house, and now you're taking this antihistamine, it's drying your mouth out, and I take a look in your mouth and go, ooh, you know what? We better start cleaning your teeth twice a year, because I just want to keep you in a healthy zone. The other topic that, when you're talking about inflammation, the other topic we haven't really talked about here today, and I can't remember if we did on the last podcast, is this connection between inflammation in the mouth and systemic disease in the rest of the body. And we're starting to make a lot of connections on the pathways, and particularly with gum disease. And I think most patients have probably heard this most people have, either heard this on the news or they've seen it on one of the morning television programs. But we've made a pretty strong connection between inflammation of the gum tissue and the microbes that cause that drive that disease. And then inflammation of the blood vessels in the rest of the body, which so now we're talking about in the brain, we're talking about bleeding episodes in the capillaries and small arteries there, and we're talking about strokes. In the heart, we're talking about heart attacks. And a number of those bacteria, periodontal pathogenic bacteria specifically, we have identified that play a role in heart attacks and strokes. And actually one of them has been demonstrated. I think the paper was published 2 years ago that it's actually causative in heart attacks and strokes. So you really want to have a healthy mouth if you want to live a long time and be healthy and have a healthy heart and healthy brain. You want to make sure you got a healthy mouth. I tell audiences this as well. It's like, I can't conceive now that if you've got a really unhealthy mouth, you can't have a healthy body, and vice versa, right? I mean, it's like,
it's true.
It's not possible to have a healthy body if you've got a lot of disease in your mouth, because the mouth is part of the body. It is connected. One of the other things we've identified in the last 3 years is starting to look at, well, what other bacteria and microbes are present in those conditions, the heart attacks and the strokes. And interestingly enough, a number of the bacteria that we've traditionally implicated with tooth decay, we're finding in shocking numbers in those clots and the heart attacks and in the microbleeds in the brain. So again, you can't have a mouthful of decay and have a healthy body. It just doesn't work that way. So, the best thing you can do to protect your arteries and protect your heart and the rest of your body is make sure you're taking a good care of your teeth and your gums.
Have you thought, or is it even possible to have a different protocol for people, patients with diabetes or previous heart conditions, or if they're high risk for heart conditions? I mean, is there anything you can do as a dentist to help them?
Yeah, I mean, again, so typically we associate that with gum disease, and the studies are pretty clear too. I mean, the best thing that we can do to prevent, episodes like that is to have them have their teeth cleaned, their roots cleaned like 4 times a year. So yeah, that's the best thing that we could do. And actively treat, if they have any bleeding sites in their gum, actively treat those sites to reduce them. And if they have a lot of tooth decay, actively treat that as well. And help them, again, identify what's causing their disease and see if they can't mitigate those risk factors. One of the challenges that we have in both gum disease and cavities is that there is a component of genetics involved. And like I said earlier, I can't change your DNA. But we know that you may be at greater risk for either cavities or gum disease because of, your genetic makeup. And we can't necessarily measure that just yet. We have a couple of genes we can test for in gum disease, but we really don't have any genes that we're actively testing for yet in terms of your risk for cavities. But that's the future. I mean, so what I can't tell you is I can't change your DNA, but I can help you understand how much more susceptible you are, so that those acidic episodes in terms of tooth decay, those acidic episodes we need to minimize, and we need to have you at least be aware of them, so that maybe you can change your lifestyle a bit to address that, to just protect yourself as much as you use oral health care that are protective. Yeah.
All right, Kim. Well, this is good. We're out of time now, but it's been a great call. How can people get your mouthwashes and toothpaste and all that? Where can they go to find out more and to get that stuff too?
So we have a great website. It's CariFree.com, CariFree.com. And so we have a lot of information, like educational material on there. We're really an educational company that provides materials, healthcare products. But so there's on that website, it's information rich in terms of being able to help identify if you have this problem, and then what kind of approach, what kind of oral healthcare products would be best for you to help, again, minimize your risk. So they can get that from the CariFree website. Our products are also available on Amazon. So
tell me 2 levels. Someone that is listened and they just want to try stuff and go in at a low level. What would they do, or what would they buy specifically? And then someone that feels like, all right, I want to go all out and help myself. What do I buy then? What do those 2 things look like?
So I would, if you were just, low level and you just want to try a new product and see if it makes your mouth feel better, I would try just either our 1100, our CTX3 gel or rinse. So our 3 gel rinse or or gel or rinse. And if you had a few cavities and you're more interested in that, I'd certainly would talk to your dentist, and your hygienist, your professionals about that. But you could get our products also on the CariFree website, and you probably would want to go to like the treatment rinse. But again, I'd really encourage anybody that has some disease to see their dentist and talk to their hygienist about it, and talk about, they can certainly ask questions about the CariFree products. But I would want to put a person like that on a 5,000 part per million gel, and that's a prescription only in the United States. And then the treatment rinse has some antimicrobial activity. And again, they can order that direct on the CariFree website, but again, really love to see them be under the supervision of a dental professional while they're working.
Makes sense.
Yeah.
Well, Kim, thanks for coming back. It's been another great call.
Thanks, Richard. Yeah, I enjoyed talking to you, and I hope everybody has a great day.
You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you've enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you.